Hey everybody, it's low carb and keto nutrition specialist Amy Berger bringing you the one and only keto without the crazy. Ladies, we need to talk about PCOS. So not just the ladies, this is good for the gentlemen out there too, but ladies, any of you who are living with PCOS, this is for you, and I need you to do me a favor. Please share this video with anyone you know that is affected by PCOS and who might get some help out of this video. Why do we need to talk about PCOS? Well, I know that there's a ton of you out there living with it, and it kind of breaks my heart that some of you might be looking into or have already opted for expensive, invasive fertility treatments and all kinds of other treatments, and you're taking medications when PCOS is relatively easy to correct. Now, right here at the outset, I've got to make it clear, I'm not a physician, I'm not a medical professional. This is not medical advice. I'm not diagnosing, treating, curing, preventing anything. I am sharing information with you, but I have to share this information because you deserve to know. You deserve to have the facts so that you can feel empowered to really do something about this. I have some notes. Actually, I have lots of notes. I'll try to do things in some kind of systematic order and not have this video be an hour long. I am going to link in the notes to a blog post that I wrote about PCOS years ago. It's kind of an old post. It's so old that some of the links might actually be broken, but the information in there is every bit as accurate and every bit as relevant today. So if you happen to be interested in the details and you love digging into the science, digging into the research, definitely check out that blog post. Again, link in the notes. There's such a fabulous image of some of what I'm going to describe with the hormones that go on in PCOS, and it's really hard to just talk about it, but if you look at it, it's just a really great image for you. Okay, before I get into things, I want to share with you that I will be quoting from the chapter on PCOS from this book, Ketogenic, The Science of Therapeutic Carbohydrate Restriction in Human Health. This came out, I think, in 2023. Don't quote me. It's relatively new, kind of thick. It's basically a textbook. It is a ketogenic textbook that covers almost anything under the sun related to a ketogenic diet, all kinds of health conditions, weight loss, obesity, all the things. In fact, I had the truly amazing privilege of being invited to contribute a chapter. I, together with the inimitable, amazing Dr. Georgia Ede, co-authored the chapter in this book on Alzheimer's disease. So I'll put a link to this book in the notes as well, but I'm telling you, this is not an easy read. It's not a diet book. There's no food list. There's no meal plan. This is a textbook. It is not for the faint of heart. I have trouble understanding some of the stuff in here, but again, for those of you out there that love to geek out, and I say that as a compliment, you love to nerd out on this stuff and you don't know about this, get yourself that. If you don't know who Georgia Ede is, and I swear I'm going to talk about PCOS soon, Georgia, Dr. Ede, my co-author on that chapter, is the author of this book, all about keto, carnivore, paleo, and just healthy diets for mental health. They are doing some really phenomenal, groundbreaking research on ketogenic diets for schizophrenia, bipolar disorder, major depression, anxiety, just absolutely mind-blowing, life-changing stuff. And so, link to this book in the notes. Okay, let me keep this other one on my lap so it's handy. Let me see. Back to the notes here. Yeah. I just wish that more women with PCOS knew what the real driving factor was, because like I said, it's relatively easy to correct, and the research backs me up on this. I'm not just making stuff up. And to think of the lengths that some women are going to, I mean, heartbreaking stuff, like trying to conceive for years and years and it not working, and even going to the very expensive invasive fertility treatments and still having those fail. And it doesn't have to be this way. So hyperinsulinemia, chronically high insulin, is the cause of PCOS, period, end of story. The cause of PCOS is chronically elevated insulin. And again, I'm not making that up. It is very rare in a research paper or just some published review paper for them to come right out and say that something is the cause of something else. They almost always hedge their bets and say something like, X factor is associated with Y outcome. This thing has been linked to this other thing. There's at least one paper about PCOS, and I linked to it in the blog post I mentioned, where they come right out and say that hyperinsulinemia, chronically high insulin, is causally related to every factor, every facet of PCOS. And I'm telling you, it's very rare for them to use the word causal or causally related, and they did. And so why is that? I mean, insulin is a blood sugar hormone, right? I mean, everybody knows insulin lowers blood sugar. That's why people with diabetes who, are no longer responding to the oral medication, they get put on insulin. Or if you have type 1 and you need insulin because your body doesn't make it anymore, insulin is given to help lower the blood sugar. Well, great, that's fine. But insulin, like every other hormone, doesn't just do one thing. Insulin has so many other roles throughout the body. And so even when your blood sugar, your blood glucose is normal, if you have high insulin most of the time, that hyperinsulinemia, you can have any number of health problems. And this is just simply not recognized enough in the average medical office, in the normal conventional medical world. It's kind of starting to be more recognized, but the fact is, even if your blood sugar is normal, even if your hemoglobin A1C is normal, so you are not diabetic, your doctor has no concerns about your blood sugar, but if you have PCOS, you take it to the bank that you have high insulin. You can get your fasting insulin level measured. So you can measure fasting insulin just like you can measure your fasting blood glucose, like they do at a normal checkup. It's not a routine part of a standard checkup or standard blood work, the fasting insulin. You have to request it. You can do it on your own in the US. I will maybe put a link if I can. There's just any number of labs where you can get it done on your own, and it's actually relatively inexpensive. But I want to point out that it is possible to have a normal fasting insulin level, meaning just like your fasting glucose, you get that blood drawn first thing in the morning before you've had anything to eat or drink besides water, like a normal fasted blood draw. Your fasting insulin level could be normal, but if your insulin level rises very high after a meal, particularly a meal high in carbohydrate, if that insulin rises extra high and stays elevated most of the day, then you have hyperinsulinemia even if that fasting insulin level is normal. So like I said, insulin has numerous other jobs, just like any other hormone. And so if you have chronically high insulin, then how else is it affecting your body? Well, in women, insulin, chronically high, insulin is a hormone. We all need it. It's not a problem unless it's too high too much of the time. And when that happens, chronically high insulin raises testosterone in women. And women need testosterone. It's not a male hormone. It's just a hormone. We do need some, but if we have too much, we start to get some of the signs and symptoms of having too much testosterone, like facial hair or hair, extra hair growth elsewhere on the body. It's normal to have body hair, but when it's kind of excessive in other parts of your body, they call that hirsutism or hirsutism, just extra hair, oily skin, acne, irregular periods, maybe missed ovulation, because it affects, well, the chronically high insulin affects a lot of the other hormones involved in the menstrual cycle. It doesn't just affect testosterone, but that elevated testosterone explains certainly some of these symptoms. Even some women can have a deepening of their voice because the testosterone is elevated, and that's like a male secondary sex characteristic, is the deeper voice. Chronically high insulin also lowers something called sex hormone binding globulin. So testosterone will float around in the bloodstream bound to a binding protein. And because you can't just have hormones like floating unassisted throughout the blood and latching on everywhere. So it's bound. Chronically high insulin lowers the sex hormone binding globulin, the binding protein, so that there's more free testosterone. So not only is there more testosterone, but more of that testosterone is actually free to come and enter the cells where it's going to have those sort of masculinizing effects. Chronically elevated insulin also affects something called the the LHFSH ratio, the luteinizing hormone to follicle stimulating hormone in your body. And those are very intimately involved in regulating the menstrual cycle. And this is a little bit unscientific. I'm trying to speak in really simple terms so you can get this picture. Your ovaries have lots and lots of eggs in them. You know, you're born with them. And so every month there is luteinizing hormone that comes along and kind of sprinkles itself all over those eggs and kind of gets them ready for fertilization, for something to happen. So that's luteinizing hormone. And follicle stimulating hormone stimulates one of those follicles, one of those eggs, to be ovulated, to come out. You know, and what chronically elevated insulin does is raises the luteinizing hormone and lowers the follicle stimulating hormone. So you've got a skewed ratio compared to normal. So you've got this luteinizing hormone like extra doing its thing on those eggs, on those follicles, but there's not enough, there's a relative insufficiency of the follicle stimulating hormone. So you've got all those follicles, you know, it's almost like you know, luteinizing hormone, think of like fertilizer. It's not fertilizing the egg, but it's like a little miracle grow for them. So you've got all these kind of little follicles, but none of them is being stimulated by the follicle stimulating hormone, which is why so many women with PCOS do not ovulate, or you have irregular ovulation. And what's left behind then are those follicles that have been kind of peppered with that luteinizing hormone. You've got all these like larger follicles, some of which may grow into cysts. And if there's more of them, it is polycystic, hence the polycystic ovarian syndrome. But you need to know, not every woman with PCOS has cystic ovaries. You can have PCOS without cysts in your ovaries, so it's actually kind of a misnomer. Multiple cysts in your ovaries is actually not required for the diagnosis of polycystic ovarian syndrome, go figure. So actually what is required, it's a syndrome, right? Polycystic ovarian syndrome, meaning there isn't one single blood test. It's not like a bacterial infection where, oh, you have that thing, you've got that disease, here's the drug that treats it. PCOS, because it's a syndrome, it's a constellation of factors that if you have multiple of these factors, you know, plus, well, the factors are signs and symptoms, then they will diagnose you with PCOS. It's sort of a differential diagnosis, like ruling other stuff out, and you've got all this stuff that really points toward PCOS, like the problems with ovulation, the irregular periods, the facial hair, the acne. They will often measure the testosterone. Maybe they'll measure your insulin. Maybe they'll measure that luteinizing hormone and follicle stimulating hormone. It's that stuff, it's that cluster of signs and symptoms and indicators that would prompt a diagnosis of PCOS. And I will come back to that because I think that matters. So, elevated insulin causes all of this. Like, that's the what you really need to know. And I'm going to read here from this textbook, the PCOS chapter. In PCOS without type 2 diabetes, remember I said you can have the high insulin, the PCOS, without type 2 diabetes because your blood sugar is normal. In PCOS without type 2 diabetes, you most often find normal blood glucose but high blood insulin concentration. This situation is often called insulin resistance. This is the key to understanding PCOS and indeed all the metabolic diseases. The underlying problem is the same, meaning in PCOS and type 2 diabetes, non-alcoholic fatty liver disease, skin tags, there's so many other things. The solution then becomes immediately obvious. We need to lower insulin. Sometimes textbooks aren't that complicated and they just come right out and say what needs to be said. And, it's pretty telling that the go-to drug for PCOS is metformin. And in case you were not aware, metformin is a diabetes drug. They prescribe it for other things, namely PCOS, some other things too, but the fact that that is the go-to pharmaceutical treatment for PCOS should tell us a lot. Like, I'm not diabetic. Why am I taking a diabetes drug? Well, there's some connection there to glucose or insulin or something, right? Excuse me, I'm going to pop a cough drop. I am getting over something. Hopefully it is a sugar-free cough drop. Hopefully it won't get too much in the way of me talking here. But, that really should tell us something. And metformin is an insulin sensitizing drug, meaning it makes insulin work a little bit better in your body. It makes your body more sensitive to insulin, meaning that you need less insulin. If your insulin sensitivity is greater, then you don't need as much insulin to have the same effect. So if we lower insulin, we can start to improve some of the signs and symptoms of PCOS being caused by the high insulin. So if high insulin is the cause of PCOS, then we need to fix the insulin resistance. And metformin can help that, but you know what helps it much, much better? A very, very low carbohydrate or ketogenic diet. The research bears this out. There's some very interesting studies on PCOS. My friend and co-author, Dr. Eric Westman, very well-known, esteemed keto authority, did probably the earliest study on keto for PCOS. It was a very small study, only 5 women, but all 5 women had previously, I think, don't quote me on this, at least 2 of them. All of the women had PCOS. All of them, after the ketogenic trial, massive decreases in insulin. I think the fasting insulin decreased an average of 50%. I mean, it was cut in half. And of course, the testosterone came down, triglycerides came down, all that other metabolic stuff. There was an improvement in that luteinizing hormone and follicle stimulating hormone ratio. I mean, everything that we would want to see improved, including the fact that out of 5 women, and it's a small group, I know, but out of 5, 2 of them got pregnant during the study, despite having been unsuccessful with previous fertility treatments. And I want to say that the study was all 5 had previously had unsuccessful attempts at fertility treatments. I don't recall if that's correct, but I do know specifically that the 2 women who conceived on the ketogenic diet without fertility treatment had previously been unsuccessful with fertility treatments. So that, maybe it was a coincidence, but there was another study done much, much more recently of women with PCOS, all of whom had been unsuccessful at attempts with fertility treatment. And in this newer study, not all of them successfully conceived, but 2/3 did. About 66% of them conceived. Now, they were using fertility treatments again, but this time in combination with a ketogenic diet. So they had previously been unsuccessful with the fertility treatment. Now they tried fertility treatment plus keto, and 2/3 of them had successful full-term pregnancies. So, can I promise you this is a slam dunk? No. Is it absolutely worth trying? Yes. And of course, if you have PCOS and you're not trying to conceive, you don't want to conceive, you're not ready to conceive, it's not for you or not for you at this time, if you go on a ketogenic diet, please take protective preventive measures, because there have been quite a number of surprise keto babies among women with PCOS and not, just women who weren't expecting, to conceive. And really, it is because keto is that powerful. And it is precisely because by correcting that chronically high insulin, keto helps to normalize or improve at least all of those other hormones. You start to ovulate regularly, or it may be better than you were. All of these good things happen, and you can conceive when you were not really prepared to. So you definitely want to take those protective preventive measures if you are not aiming to conceive and you go on a ketogenic diet if you have PCOS. So that is a word of caution. And so let me see if there's anything else in it. Yeah. Remember I said metformin is the most commonly given drug for PCOS. And metformin is absolutely helpful. If it wasn't that helpful, they wouldn't prescribe it as much as they do for diabetes and for PCOS. But is it as effective as simply not having the problem of chronically high, insulin in the first place? And how can we do that? Get to that in a second. Back to the book. Most PCOS treatments, with the exception of metformin, do not treat the underlying pathology of hyperinsulinemia in PCOS and should be adjunct treatments, meaning metformin should not, and the other treatments that don't address the hyperinsulinemia should not be the main treatment. They should be adjunct treatments, like added on to something that actually works. By focusing efforts on serum insulin reduction, not only do we address the symptomatic relief of PCOS as well as infertility, we also reduce the risk of the metabolic consequences of insulin resistance in patients with this condition. It is incomprehensible that this is not the focus of current medical therapies for PCOS and begs further consideration, as many of the current treatments are insufficient. Yeah, why is a ketogenic diet not the frontline therapy for PCOS? Now, not everybody's going to want to do a low-carb or keto diet. That's fine. It's not for everybody. Well, it can be, but if not everybody's going to want to do that. But it should be offered. It should be suggested. It should maybe even be recommended, like a doctor, medical nurse practitioner, PA, whoever. Please know, I never mean to offend all the lovely nurse practitioners out there and all the PAs out there. I often will just use the term doctor as shorthand. Sometimes I'll say qualified medical professional. That's a real mouthful. I use doctor to mean anyone with this prescribing, testing, diagnosing authority. So, what was I saying? Yeah, a medical professional should maybe inform a woman with PCOS, hey, a very, very low-carb diet is the most effective, most powerful thing for this. Is that something you're interested in trying? If yes, great. I'll give you a food list, or I'll send you to a nutritionist. You could book a consultation with Amy Berger. If not, let's look into this other stuff. Here are some other options for you. Or maybe, I'll give you metformin. I think it's helpful, but I think you should also do a low-carb diet, because the combination of the two, like, wow, that's a 1-2 punch. But I will tell you, the study that Dr. Westman did, where all those women had such amazing decreases in insulin, decreases in testosterone, all the other improvements, there was no metformin in that study. So, and what else? I mean, yeah, keto nobody can be forced to do keto, but you deserve to know that that is probably the most effective, most powerful thing for this condition. And if it's your choice to not do it, then okay, that's fine. Or maybe you just want to go on a low carb diet, low-ish carb. Maybe that would be enough. Maybe you don't have to go ultra strict keto. Not everyone does. To lose weight, to even improve blood sugar, say goodbye to type 2 diabetes, not everyone needs crazy strict keto. You could just cut way back on sugar and starch and see how far that gets you. All I want to do is just let you out there know how powerful low-carb keto is for this. And, in this textbook, they said something about not only does carbohydrate restriction improve the hyperinsulinemia, but it reduces the risk for all the other metabolic consequences associated with PCOS, like all the other metabolic consequences that come from chronically high insulin, the type 2 diabetes, the non-alcoholic fatty liver, the weight gain, the skin tags, all the cardiovascular disease over the long term absolutely can come from insulin resistance. It's not the saturated fat clogging your arteries, believe me. And a lot of women with PCOS, I see it online on social media all the time. They'll say something like, I'm at greater risk for diabetes because I have PCOS, or I'm at risk for metabolic syndrome because I have PCOS. I've got a piece of news for you, ladies. Ladies and the men out there. I meant to be clear about this at the beginning. Gentlemen, if you love or know a woman with PCOS, your wife, your mother, your sister, your daughter, your aunt, your coworker, your boss, whoever, send this to them, or this will maybe help you understand what's going on with them. So, yeah, this isn't just for women. It's for men who have a woman in their life with PCOS. It's for men who just are interested in learning about this stuff. Okay. So when these women say, I'm at risk for diabetes, I'm at risk for metabolic syndrome, as far as I'm concerned, you already have metabolic syndrome, because metabolic syndrome is basically it's insulin resistance. It's chronically high insulin. Again, it is a syndrome, just like polycystic ovarian syndrome. It's a cluster of symptoms, so you might not be officially diagnosed, but you're well on your way there. And again, I'm not a doctor, but in my opinion, you could consider yourself to already have metabolic syndrome. And some people would say you could consider yourself to be diabetic. All you're lacking is the high blood sugar. The reason your blood sugar is not high is precisely because you have high insulin. Your chronically high insulin is keeping your blood sugar in check. If you didn't have that high insulin, your blood sugar would be high. So it's almost like that insulin is masking the diabetes. It's making it so you don't have diabetes, but you don't want to have the high insulin either. So if that kind of makes you, or helps you rather, take this more seriously, you could consider yourself to already be diabetic. All that's missing is the diagnosis. All that's missing is the high hemoglobin A1C. There's research has shown that blood sugar rising is a late stage in the process of developing type 2 diabetes, because you can have this elevated insulin for up to 20 years before even that high level of insulin is no longer sufficient to control the blood sugar. And then the blood sugar is finally rising enough to the point of triggering the diabetes diagnosis, but it's been kind of rising in the background for years. Okay, that's enough about that. So why is this gal on YouTube going on and on and on about keto? Well, I kind of got ahead of myself, because I know most of the people watching my channel are already following low carb and keto diets, but if someone has lovingly sent this to you to try to give you some information. You know, we never do it out of judgment or like, you should eat keto. Da, da. No, they just want you to have this information, and so do I, because PCOS is not fun. PCOS kind of sucks, right? If you have it, you probably wish you didn't have it. So, and there's a way. There's a way to not have it, or to, you know, improve things to the point you might still officially have the diagnosis, but as far as you would be concerned, if your hormone levels are all normalized and you conceive a child, or your menstrual cycle just regulates, then, you know, kind of good to go, even if that thing is in your medical chart. So, all right, keto really, really helps to control insulin, because insulin can rise for a number of reasons. Just any other hormone is affected by numerous things. The biggest contributor to raising insulin and keeping it elevated is eating a lot of carbohydrate, or drinking a lot of carbohydrate, drinking a lot of sugar, fruit juice, smoothies, you know, high carb shakes, sugar sweetened sodas, high fructose corn syrup sweetened sodas, energy drinks with sugar and all kinds of corn syrup, and just carbs, sugar and starch, bread, pasta, rice, cereal, granola, potatoes, and then, you know, the abject junk, donuts, cookies, sweets, whatever, you know, what have you. I don't even know what people eat anymore. Can some people eat this stuff and remain lean and not have any metabolic problems? Yeah, you bet ya. We all know them. They're out there. Can some of us have some of this stuff now and then and remain healthy, remain lean, have no problems with insulin or sugar? Yeah. But some of us can't. Some of us are very, very sensitive to carbs, to the point where our blood sugar and or insulin is going to just rise a lot. We're going to eat, you know, a reasonable amount of these foods, and the insulin is just going to skyrocket, and it's going to stay elevated. Like, by the time you eat your next meal, it still hasn't even come back to normal. So it's kind of riding that high wave all day. This is very, very common. This is like millions and millions of people. Not everybody gets PCOS. Some women will get skin tags, and I point here because they're very common around the neck or in the underarm. Some people will have non-alcoholic fatty liver disease. Some people will get migraines. Some people will get gout. Some people will have cardiovascular disease. There's all kinds of things that can come from this chronically elevated insulin. Just depends on your individual susceptibilities, your maybe, you know, genetic tendencies, family history. Some of us will get PCOS. And I really have to emphasize this weight thing, because many people with chronically high insulin will be heavy, because insulin is a blood sugar lowering hormone. It's also a fat storage hormone. Chronically high insulin makes it very, very easy for your body to store fat, and very, very difficult for your body to release, very difficult for it to lose weight. But not everyone with PCOS is overweight. It's kind of a stereotype that the stereotypical PCOS patient is this kind of heavy-set woman. Not always. You do not have to be overweight to have PCOS. So I really want to make sure that that's clear. However, I explained earlier that PCOS is a syndrome, polycystic ovarian syndrome. It's a differential diagnosis when they've ruled other things out, and you've got all these signs and symptoms and things that point toward PCOS. But I think that unfortunately PCOS has also become a catch-all diagnosis. They tell you have PCOS if you are a woman and you have irregular periods. Like, oh, it's PCOS. You know, you're a woman, you're not ovulating, or your ovulation is irregular. It's just, you know, whatever. You have PCOS. And it's not always true. PCOS is not the only cause of anovulation, meaning lack of ovulation. It's not the only cause of irregular periods. It's a lot of other things that affect us, fragile females and our fragile hormonal webs. And I'm being a little bit sarcastic there because we're not that fragile, but our hormones are affected by a lot of different things. And I honestly think, and this is my opinion, just my opinion, I think that there are a lot of women being misdiagnosed as having PCOS. If you, I specifically mentioned that you don't have to be overweight to have PCOS. There are thin women who have PCOS, but if you are on the much thinner side and you do not have the elevated insulin and you do not have some of these other hormonal things going on, you do not have a lot of the other signs and symptoms, you might have amenorrhea, lack of a menstrual cycle, or anovulation for other reasons. One of the most common is simply under eating. Basically, too drastic a calorie restriction. All these young women especially try to diet their way down to I don't know what and simply not eating or not eating enough. There's also the female athlete triad, all of you very, very athletic women that like to work out 10 days a week, 3 times a day, and you're not eating enough to support that level of activity. You're demanding a lot of your body and you're not nourishing it in the way it needs to be nourished to support a healthy menstrual cycle. When you are starving, you're not trying to starve yourself, but your body is being starved of the nutrients it needs, of the calories it needs, the energy and the fuel it needs, then reproduction shuts down. Your body is not stupid. Your body gets the message, whoa, there's a famine going on because we are not getting enough food. It is not safe to bring a baby into this world. It is not safe to conceive right now. We don't have enough food. We better put the brakes on this reproduction thing. We better not be menstruating. We better not be ovulating. So I think there's a lot of women out there being diagnosed with PCOS who do not have PCOS. You have amenorrhea for some other reason, usually under eating, sometimes chronic stress. Could be mental, psychological stress. You're going through something really crazy. You lost your job, spouse, death of a spouse, who knows what, some type of crisis, going through a divorce. And typically it's not just one thing like that. It would be that you are going through something really stressful and you're not eating because of it, or you're not sleeping because of it, or you are barely eating or not eating enough and over exercising. It's kind of a confluence of factors, but my point is that don't assume you have PCOS just because you have irregular periods or just because you haven't had a period in 4, 6, 8 months. It's not automatically PCOS. So I really think it's important to work with your medical professional to evaluate all this other stuff. Get your testosterone measured, get your insulin measured, get your, even though I mentioned that fasting insulin can be flawed, it is still worth doing. Because if your fasting level might be normal, but it's elevated throughout the rest of the day. But if that fasting level is elevated, especially significantly, then you know right off the bat there's a problem. Get that luteinizing hormone, FSH hormone ratio measured. Get all that stuff measured. And then, of course, go by your signs and symptoms. So I only mentioned the keto diet briefly, it's the foods and drinks. So, a keto diet corrects this by eliminating the foods and beverages that keep that insulin high. When you simply avoid the things that have the most powerful effect on keeping insulin high, guess what? Insulin isn't high anymore. And it doesn't happen overnight, but can happen pretty quickly, like those 2 women conceived, I think, within weeks of starting the keto diet for that study. So, If the problem is chronically high insulin, then the way to correct the PCOS, the way to correct any of these metabolic syndrome, insulin resistance associated things, is to lower the insulin. And really, truly, I would say the quickest, most powerful way to lower insulin is to go on a ketogenic diet. You could also fast, but we like food. Food is yummy, it's tasty, we like to eat it. And so if you don't want to just fast forever, which, by the way, I don't recommend that you fast forever or do any extended fasting really, but just go on a diet. Eat in such a way, adopt a way of eating that allows you to eat when you're hungry, eat to satiety. You don't have to restrict calories. Like if you're hungry, you can eat as much as you need to feel satiated, to keep you going for a few hours. You just eat the foods that don't raise insulin all that much. And that's going to be non-starchy vegetables. It's going to be healthy fats. It's going to be proteins. And I know you sticklers out there, protein does have a small effect on insulin, but protein is also essential to eat. So we have to have some of it. And if you do a very low carb or ketogenic diet, the effect of protein on insulin is much less compared to the effect of carbohydrate on insulin, especially refined carbohydrate like bread and pasta and crackers and cookies and ice cream and pastries and sweets and all that stuff. Broccoli is a carbohydrate, but the effect of broccoli on insulin is like really not that much compared to a cupcake, compared to a donut. And again, a steak, a piece of chicken compared to a donut, compared to a cookie, going to have a little impact on insulin. That's fine. Protein is supposed to do that. So the nice thing about keto is that you can have a significant impact on normalizing, or at the very least vastly improving, all of these hormone levels, the imbalance of which is what is causing all of the stuff you're dealing with if you have PCOS, right? If you're, carrying that extra weight, if you've developed the facial hair and the excess body hair, maybe the deepening voice, the acne, the oily skin, all the stuff. So keto is just very good at improving or correcting this without you having to starve yourself, without you having to count calories, without you having to figure out macros, without you having to micromanage your diet and, upend your entire life to turn your food into your full-time job. If you need help with the keto diet, if you're looking for a simple, sane way to do it, if this is the first time you've heard that you could do keto without counting macros and without fasting and without going to any crazy lengths, you've come to the right place. You found keto without the crazy. I am available for private one-on-one consultations. There's a link in the notes to every video that I do. Feel free to contact me if you need help. I also have a Patreon. If you would rather not do a private call, if you need a support group, we have weekly calls at least once a week, more than once a week depending on what tier you subscribe to, so that's available. I hear from people all the time, I'm struggling, I need support, I can't figure this out. Help is available. Stop trying to do this on your own. Stop trying to figure it out by yourself, floundering, guessing, listening to a million influencers, and you don't even know what to do anymore. Keto without the crazy help is a click away. Check out all the links in the notes. Let me just look at this one last time to make sure I haven't missed anything critical. Ooh, I did. I wanna share something that I'm a little hesitant to share because I don't want anyone out there taking offense. I find this fascinating, this bit that I came across. PCOS is not new. The name is new. I don't know when exactly that phrase was coined, but that term, polycystic ovarian syndrome, is relatively new. But the recognition that there were women who had deeper voices, who had even more manly shapes, more masculine shapes, who had problems with fertility, who had problems with their menstrual cycles, who had acne and facial hair, has been recognized since ancient times, since the 1500. Well, 1500 isn't ancient. This book talks about the time of Hippocrates, which was like ancient Greece, but 1500s more like, they talked about bearded women, and then in the 1960s and 1950s, there were papers published with the phrase diabetes of the bearded woman. So they knew that there was some connection between diabetes or chronically high blood sugar, or what we know now, chronically high insulin, and the facial hair. And we know the facial hair is just one symptom, but they also talked about these women having robust bodies, you know, and all I can think, and here's why you're going to see I'm hesitant to mention this, because I don't want to offend anyone, but I just find it fascinating. Think back to decades ago, centuries ago even, maybe not centuries. I don't know how old circuses are. But circuses used to have a bearded woman, right? The bearded lady. And she was literally a sideshow freak, right? She was in the circus sideshow because it was so unusual. Oh, there's this woman with this beard. Now, granted, maybe some of that was a hoax. Maybe some of that was fraud, and they just put a fake beard on a woman. Sure. I mean, there was Photoshop before there was Photoshop, right? They just did it in real life. But it really tears at my heartstrings to think of how many of those women, those bearded women's sideshow displays, might have simply been women who today would be diagnosed with PCOS. Those women probably simply had chronic hyperinsulinemia, and nobody knew at the time. Nobody knew what it was, so nobody knew how to correct it. And please, like, the reason I was hesitant to mention this is I don't want anyone to even remotely think that I'm calling women with PCOS sideshow freaks. Like, no. I'm just mentioning this because I am fascinated but heartbroken at the same time to think that that is very likely what was going on with the bearded lady or the bearded ladies of their time. 100 years ago, 200 years ago, before they knew what this was. But now we do know what it is, and we know that there's a very simple, straightforward way to correct it. So, you know, if you are a woman with PCOS who has used the keto diet or who is using a keto or low carb diet now and you're having great results, please leave me a comment. Share it with the world. Other women need to know about this. So I'd love to hear from you, or if you're new to keto or you have PCOS and you didn't know some of this, you know, please, if this is new, leave me a comment. Share this video with anyone you think needs to see it. I just wish that more women knew about this. And again, I'm never going to shove keto down anyone's throat. You might not want to do it, but you deserve to know that it's not only an option, but in my opinion, the most powerful and most effective option for you. And, you know, if you're not ready to do keto, I can meet you where you're at. Let's cut the carbs gradually. Let's go low-ish carb, lower carb than you are now, and see how far that gets us. Maybe we need to move further over time. And I mentioned real quick before I close out, I mentioned the metformin. They also very often recommend, and I say recommend because it's not drugs, it's nutritional supplements. They use inositol and, well, I guess berberine or chromium for PCOS. Inositol is the most widely used supplement for PCOS, but inositol, berberine, and chromium are all well known for helping to improve insulin sensitivity, for helping to lower those insulin levels, and also blood sugar if you have diabetes. And I have nothing against those. The research on inositol for PCOS is actually pretty impressive. It's nowhere near as impressive as the ketogenic diet. But if you wanted to cover all the bases, there's no reason you couldn't do all of it. It's not mutually exclusive like you do a low-carb keto diet, or you take inositol, or you take berberine. You could do it all. I'm just saying some of the research showing how effective keto is did not use those supplements. So we know that keto works without those supplements. We're not certain how much added benefit there is if you use some of those supplements in conjunction with keto, or if you use metformin. But me not being a medical person, I wouldn't be able to give you metformin, but I could recommend you these supplements. I hope that is helpful for someone out there. I really do. This is one of my longer videos, except I did that one because I took kind of a long hiatus, and my welcome re-entry video was about this long. Maybe it was even shorter than this, but this is a big topic, and I refuse to shortchange it. I refuse to give a 50-minute topic a 10-minute video or a 20-minute video. So I hope you've made it this far. I really appreciate you watching. And until next time, you know what to do. Promise me you'll keep the crazy out of your keto. See you next time.